Who's got being pulled in a lot of directions here. So we really appreciate you spending some time with us. Thank you so much. Medical Director for the Aliveness Project, Matthew Hartle. Thank you.
Yeah, thank you for having me. So
we want to talk about this breakthrough treatment for HIV prevention. Just got FDA approval. And just to set the stage a little bit for folks, and correct me if I'm wrong, but twice a year injectable medication. And it sounds like in clinical trials, it's just been incredible, shown to prevent new infections. So what are some of the ways that this will sort of change the game for HIV prevention?
Well, you know, people coming in to get their coming in for their appointments, they only have to come in twice a year, and that's been access is the biggest thing for people to get treatment. Here at Aliveness, it's, community centered. It's not your typical like hospital-based clinic.
And you're going to be talking, we're talking about at-risk populations as well. And, the accessibility piece too is really interesting to kind of dig in on. So, we're talking about access here in the US, but also I imagine, we think about HIV and how it affects us here in the US, but globally, sometimes we don't often talk about that. So I imagine this is just, huge for that.
Yeah, there's one other injectable that's every 2 months right now, and we've been the largest prescriber of that medication here at Aliveness. This one, I feel, is going to be more hopefully accessible to patients and those that need it the most, the unsheltered population, those at highest risk that can't stay on the oral medications because they're unsheltered and people are stealing their meds and they're losing them.
Yeah. Do you think, is it too strong of a statement to say this could potentially be a path to end the HIV epidemic?
It could be. Most definitely. I think insurance companies are going to be the biggest hurdle just getting it approved. I think the previous injectable led the way with that, so hopefully it'll be a little easier this go around. I have, I think, 3 patients right now that I've gotten approval for. Early in the process, takes that extra time to get the medication on the insurance company's formulary and all the codes that they need for billing and getting all that sorted.
Yeah, I think I read something about it looks like insurance companies are going to try to work around some things to make it more accessible for patients. Is there a fear that I was just reading something about some Supreme Court decisions about whether this may or may not be covered by insurance or in what way? Are there concerns for you about, even though it's FDA approved, something kind of jumping in the way here and thwarting this?
There is some concerns all around with what's going to happen with Medicaid, what's going to happen with HIV prevention in general, with the current administration and what's going on. And there's a lot of unknown right now, so it's just taking it day by day.
Yeah, okay. So we'll get more information soon. I know people may be really interested in how much is this going to cost and will insurance cover that. So hopefully we'll learn more soon. I was so curious when I saw the headlines almost a week ago now. The first thing that came to my mind was, wow, this sort of a breakthrough treatment so many years into the epidemic. Many of us are old enough to remember when we first started learning about it, decades ago. How long, do you know how long they've been working on this, and why has it taken so long?
It's they've been working on it for a while. They talked about coming out with it last year, and I think it was just waiting for a second piece of the puzzle per se for the prevention.
And finally, I just want to ask you a little bit about, what what do people need to know about the state of HIV now here in 2025, here in the U.S., here in the Twin Cities metro area? You know, some people might think, well, that we don't hear about this anymore, so maybe, you know, maybe it's not as big of a problem as we need to, you know, we need to be so concerned about it. What do you want people to know, like the general public to know about HIV right now in our communities?
It is still a problem. There's still a lot of stigma surrounding it. There's still an active outbreak going on in Minnesota, northern Minnesota, Hennepin and Ramsey County. We've had 5 new reactives in the past 5 weeks. But know your status, come in, get tested. Mm-hmm. Testing is free. We do walk-in testing here at Aliveness. If you do test positive for HIV, we will get your labs, get you started on meds, get you taken care of. Everything is completely manageable.
Yeah.
There's both oral meds and in the injection for HIV treatment as well.
Well, we appreciate you spending some time with us today to just help us understand a little bit more about this. And you know, I get it. There's a lot we don't know yet as far as the details of this, but I think it's good to just let people know that this is available. It looks like it's going to be available, and hopefully will be accessible for as many people as need it. So thank you, Matthew Hartle.
Come on in, get tested, check out the new clinic. We just opened the new space in October, and it's great.
That's awesome. Tell me where the space is.
3808 Nicollet Avenue.
Okay, wonderful. Thank you, Medical Director for the Aliveness Project, Matthew Hartle. Thanks for spending some time with us today. We appreciate it.
Thank you.
Okay, take care.